Canada's new breast cancer screening guidelines have been getting mixed reviews from the medical community. Released late last year by the Canadian Task Force on Preventive Healthcare, they recommend against screening for women in their 40s who are considered low risk for the disease. Over 100 medical professionals signed a letter recently asking the Federal Health Minister to reject the new guidelines. Among them, Dr. Jean Seeley. She's the president of the Canadian Society of Breast Imaging. Good morning to you, Dr. Seeley.
Good morning.
What evidence is there that screening women in their 40s saves lives?
Well, there's quite a bit of evidence that has been shown that screening saves lives. And a very recent study published in the Cancer Journal from Sweden showed that women from 40 and up had up to 60% reduction in the risk of dying from breast cancer. So very strong evidence that screening does save lives. And we also have a Canadian study that was published about 4 years ago that showed that screening women in Canada had a 40% reduction in breast cancer mortality. And of the provinces that did screen women in their 40s, there was a 44% reduction in breast cancer mortality. So we have good evidence even in Canada to show that it really does work even in women in their 40s.
And the task force also says that women over 40 are at a higher risk of getting a false positive result. They say that can mean going through unnecessary treatment. And some argue that women should be given more choice about screening. I wonder about your thoughts on that.
Well, we actually have pretty good evidence across Canada for screening programs. So women that are in screening programs, the data is collected very rigorously. And we know that the risk of a false positive being recalled for an extra mammogram view or an ultrasound is only about 7.5% across all even 40s and 50s and 60s. So the risk of a false positive is there, but it's not significantly higher in women in their 40s than in older women. And the choices that women would like to make really are that they want to know what the benefits and the harms are. And so if you talk to most women, they are very much interested in that benefit of not dying prematurely from breast cancer. And most women are quite willing to have a false positive if they know that benefit of potentially being able to have less earlier diagnosis of breast cancer is there. The other benefit of screening is that women who have cancers detected by screening are much likely to more likely to have less treatment, so more likely to have a smaller surgery, for example, just a lumpectomy as opposed to having their whole breast and mastectomy removed, and less likely to need chemotherapy. So those are some of the benefits that we really feel are very important, and women need to be informed about this when they're making a decision about screening.
I want to look at the task force and how it at least partially explains reaching this decision but not involving your profession necessarily. You are a breast imaging specialist and that profession was not part of the recommendations. The task force claimed that it would bias the development of the guidelines, and the implication of that I would read into it at least is that because radiologists earn a living by diagnosing breast cancer, that there is the question of financial gain. Is that ever being put above the welfare of patients? I wonder what you have to say to that, I mean personally, when you hear that reasoning from the task force.
Well, I think, I understand the concern about bias, and I think we should always be aware of that. I find it very difficult to support that logic. As a radiologist earning my living doing breast imaging, that I might actually not make as much of an income by doing breast imaging than I would in other aspects of imaging. And I'm first and foremost a physician, so I see patients every day. And for me, the most important aspect of my work is how do I take care of these patients. So I find it very insulting to have that levied as a reason for not being involved. And the problem is not only that radiologists weren't involved, but breast surgeons weren't involved, oncologists, any specialists in breast cancer were not involved in the decision-making. And also there were no patients involved. So nobody who really is affected or who understands this was used in the task force. So it really, I think this is why some of the impact and the kind of response to these guidelines is being so vociferous, is because it's not the reality of what we see. And just to give you an example, a few weeks ago, I saw 9 women diagnosed. I diagnosed 9 women with breast cancer in one day of work, all in their 40s. None of them had been offered screening, and all of them were diagnosed because they felt lumps. So this is at a later stage than women who would be offered screening.
Oh, and interesting.
It really impacts me.
Yeah, it's an interesting factor to throw in to this. But it's very good to hear your thoughts on this one this morning, Dr. Seeley. Thank you so much.
Thank you very much for this.
Dr. Jean Seeley is the president of the Canadian Society of Breast Imaging.